Okay, so we are live on YouTube, Sanrai Med India channel. I would like to take this opportunity to thank each and everybody of the panel for joining here and joining our live streaming for Breast Pump Day.
Thank you so much for having us. It's a pleasure to be here.
Thank you.
Thank you. I would just want to say a brief thing about why we are here and why we are doing this live. So basically, 27 January is Breast Pumping Day, and we have here a whole panel of professionals who are helping mothers, would-be mothers, to gain their confidence in breastfeeding, breast pumping every day. So we wanted your feedback, your insights to help the mothers who are maybe who need a little guidance in terms of their breastfeeding journey. So if I can take 5 minutes of your time, and if each of one of you can introduce yourself to the audience, please. Sir, we will start with you.
Hi, Samrita, thank you so much for having me here. My name is Dr. Ashok Mittal. I work out of Calcutta and Gurugram, and I'm a pediatrician and a trained neonatologist, both in India and UK and Canada. With 25 years of experience in pediatrics and neonatology, we've been facing a lot of challenges in premature newborns and their feeding, nutrition, and development. And being breast milk friendly hospital is one of the initiative that is crucially important. And I'm very excited to do this simply because this particular session is in line with breast milk friendly initiative of Government of India.
Right. Thank you so much, sir. Arushi ma'am, if you can just give us a little brief about yourself.
Yeah, thank you so much for this opportunity. My name is Arushi Agrawal, and basically I'm a certified lactation consultant IBCLC. And I started out as a mother. My own struggles got me passionate about the cause, and I thought I should take it up professionally because it is something very, very important. And if it doesn't happen the right way, it takes a toll on the mother's confidence. So that's how I started out my journey, and it's been over 5 years. Have helped over 5,000 mothers in the same. And yes, going good. And again, this cause is it really like I'm really passionate about the cause, and I really thank Sanrai for the opportunity to create awareness around the same. So thank you so much.
We are so happy to have you on board as well, ma'am. And Ankita ma'am, finally, if you can just give us a brief.
Of course. Hi, everyone. It's a pleasure to be here. Thank you for inviting me on this wonderful platform to spread to spread awareness about such a good cause. I am a CAPPA Certified Lactation Consultant, and I've been practicing from the last 6 years, ever since I gave birth to my own son. And similar to Arushi, I had breastfeeding struggles of my own. And in Calcutta, where I come from, there are very few certified lactation consultants who women can reach out to. So that is what actually made me motivated me to take up this cause upon myself and to be the change and to spread awareness and to impart education. And I've had the good fortune of meeting several wonderful pediatricians, gynecologists, as well as organizations like Sanrai, who have only acted as a catalyst and a support to help me spread the word.
Amazing. Thank you so much, ma'am. So this is how we are going to do this. We are going to discuss a few topics individually with all of you. And please feel free to join in on the discussion if you think that you have any inputs of your own. We will start with Mittal sir, and then we will work our way towards the lactation consultants as well. So sir, we have a few questions and we would like your feedback and your expertise on it. To start off with, sir, if you can just help us and inform us what are the key benefits of basically of breast pumping and for both premature and full-term infants, and how does breast pumping contribute to the overall well-being and development of newborns in the neonatal care unit, NICU?
All right, so that's a very valid question. So this forms the basis of why we are breast milk friendly. So there are two things here. And if there are more parents joining in now or later when they view, I want to, cater my talk or discussion in a way that they understand it better rather than medical professionals. So I'll be very lucid and simple in my discussions. Now, there is a difference between breast milk feeding and breastfeeding. So breastfeeding is when we kind of speak about direct breastfeeding, direct nursing. It has got its advantages, emotional advantages, and other advantages as well. And that remains our priority. All right. It is only when direct breastfeeding is not possible, nursing directly, baby latched on mother's breast is not possible for whatever reason. Uh, there may be latching issues. There may be issues like the baby is not fit, is in an ICU for whatever reason, being premature, being very small, born too soon, born too small, or suffering with some congenital defects, surgical challenges, and stuff like that. In those cases, obviously the baby is not in a position to latch directly on the breast. In these situations, we want breast milk. So the first choice always remains direct breastfeeding. The second choice is breast milk fed by some other way. So in premature baby, one of the ways is we give it through gavage. So a gastric tube is inserted through mouth or nose that enters the stomach. And then the nurses do the job of giving the decided amount of milk, breast milk, which has been expressed to the baby for the growth and development, and so on and so forth. Now, this is where the importance of breast pumping comes in. That if the baby is not sucking, who else is going to suck? So it's a machine which is electrically operated, which creates a vacuum and generates good amount of milk flow. And the elixir of life for the baby is breast milk, and that's given. Now, if we talk about the advantages of breast milk, there are 101 advantages, and I'm not going to speak all of them here. I would say it's the right amount of food at right time, produced by nature. So this got to be the best, and science has proven it again and again, and without any doubts, that it is the best milk. In fact, parents would be surprised to know that depending on the time that the child is born and the postnatal age, the constituent of milk also changes. So a premature milk contains far more protein compared to a term milk because the requirement is more. So nature takes into account the entire situation, the requirement of the situation. And so this is amazing, miraculous work that the nature does. So we don't want to hamper or intervene into that. And we just allow that. It's direct, it's sterile. There is no middleman involved here. The mother directly gives it off. So breast milk has a lot of advantages, of course. There are short-term advantages like nutritionally, immune response-wise also. Breast milk has got lactoferrin and many other substances, which globulins, etc., which contribute to the immediate immunity transfer from mother to the baby. And it is said to be, and it is proven to be, having immunological benefits. Secondly, it's a nutritionally also, a baby who is on breast milk alone, a term baby, gains maximum amount of weight. And you will see chubby babies on exclusive breastfeeding. They don't need anything else. It is only when premature babies are born less than 1.5 kilo that we think of adding some fortifiers here and there. The long-term advantages are even more awesome and even more sort of wanted if the child is kept exclusively on breast milk for first 6 months and continued breastfeeding till 2 years of age, as mandated by WHO, we see long-term benefits like reduced incidence of obesity, reduced incidence of diabetes mellitus type 2, and reduced incidence of asthma and other allergies. So these are much bigger advantages than the short-term advantages that we can think of.
Amazing. Thank you so much for that, sir. If any one of you, ma'am, if you have to add anything to what sir said, I know that you might have a few feedbacks of your own. Please feel free to join in on the discussion.
Yes, absolutely. I think doctor shed some wonderful light on how, from a pediatrician's point of view, on how beneficial breast milk is for a baby. But I even would like to highlight the importance of breastfeeding for a mother. So being a mother myself, I do, and I'm interacting with mothers all the time, I feel that even that constant interaction between the baby and the mother, the more you interact, the more solid your emotional bond is. So the more the mother is interacting with the baby, and the baby is completely dependent on the mother for its food, the more the stronger the bond becomes between the mother and the baby, and the mother becomes confident much quicker. As soon as you give birth, for any new mother, she's very overwhelmed and she has a lot to deal with. So medically and clinically, of course, there are a lot of changes happening, but even emotionally and psychologically, there's a lot that she needs to digest. There's a lot she needs to assimilate, and there's a lot that it takes a toll on her psychological well-being as well. So when a mother is breastfeeding the baby, there are some hormones which are released by her body which make her feel more relaxed, and it helps her bond with the baby better. It has been scientifically proven, and I'm sure doctor would also agree that automatically the bonding is a lot better and mothers tend to feel more relaxed. And as doc rightly put across, we always encourage mothers to directly breastfeed their babies the minute they are born. That is the best possible solution. But then again, because we're dealing with so many mothers on a daily basis, sometimes especially when it comes to premature babies, mothers are so upset and they are so overwhelmed, and they don't know how to kind of feed their babies. They don't know how to handle the babies. So sometimes, even when they are able to latch the baby on, they want to be put on some kind of a routine. So in order to kind of mentally um, you know um, pacify them, or in order to help them go on a routine, we encourage them to have like a pumping schedule, so that they are feeling confident, because you can't see the milk transfer when you're directly breastfeeding your baby. But when you are pumping, you can see, okay, fine, I'm having so much output, I am feeding my baby through a katori spoon, or through the tube, or whatever. So the mother also feels more reassured, and automatically the she feels more confident, and it is easier for us to handle the mother, and for the mother to kind of get more her entire journey of breastfeeding becomes smoother when she's put on a routine.
Okay, so there was 2-3 topics which were discussed here, which I would like to have a more elaborate discussion on. So ma'am spoke about latching, right? There might be latching issues. I think even sir said something like that. So I wanted to have like this short discussion on this latching issue. Say, for example, so Arushi ma'am, if you could help us with this as well. Say, for example, there's a mother who's struggling with latching issues, and she's like frustrated, and she's considering formula feeding basically. So as a lactation consultant, you would need to discuss the potential benefits of using pump, I'm sure, in this scenario. How do you approach such a case, and how do you highlight the role of a breast pump in maintaining milk supply and facilitating breastfeeding success?
Right. So, correct. So, I think in today's scenario, we have a lot of cases of breast refusal because of the medical protocol, I would say. The more the cesarean births are going up, and more the child and the baby are separated, the mother and the baby are separated in the first few hours, we are seeing a lot of cases where the child is refusing to latch, or in a specific case where the child is in the NICU and we are unable to start breastfeeding. So, when we talk about in a situation like this, for intermittent period, we have to use the support of the pump, right? Because breastfeeding is a behavioral science. It is not in our control. We do give conducive environment for the baby to start latching, but breast milk is in our control. So I always tell my mothers that giving breast milk is in your control, because we can pump and give the same while we are working on direct latching. So it is an interim phase sometimes that we need to take the support of the pumps to increase the supply. A, B, also give the breast milk parallel to the child while we are helping the baby get onto the breast directly. So it is a very important step, because eventually once the child starts to latch, if the supply dips, because we all know it's all the game of demand and supply. So if the supply dips and the baby is still latching, there's no milk. So we are back to the formula intake, and we are stuck in a vicious circle. So to break the circle, pumps play a very important role to start pumping so that the supply remain boosted. And yes, we can also give the baby the benefits of breast milk parallelly.
Amazing. Thank you so much.
Yeah.
Sir, yes, sir, please.
Yeah. So coming to this particular sphere that Anita added, it's very important. One of the commonest thing that complaint that we hear or concern from mother that we hear, especially in first 7 days, 10 days of life, when they come for routine checkup, although they come for checkup of jaundice, but that's an opportunity for a pediatrician to actually sense how comfortable and how confident she is about feeding. All right. So there are things which are subjective, there are things which are objective. And breast pump helps me a lot in actually giving the mother the confidence that she requires. Because, see, the first time mother who has no experience, a 28, 29-year-old, even though there is a mother-in-law or a mother in the scenario, often, with all due respect to these elderly women, they have forgotten how they raise the children. That's the thing that they tell me. मैं जब बोलता हूँ इनको कि आपको तो मालूम होगा, तो वो बोलती सर हम भूल चुके हैं, बहुत साल हो गए. So, and they are their well-wisher, and that's a big moral support that mother or mother-in-laws. And we want them to also understand. And on occasions, I have taken extra time out to sit with mother and mother-in-law to make them understand that, see, there is a demand which is there for the newborn to grow. All right. And especially if the baby was born premature or with low birth weight, then there is a catch-up growth which is required. So we need more than what is normally required for a particular baby in a baby who is deprived of nutrients in the uterus. Now, so sometimes quantification helps them because, as Anita said, when you directly breastfeed, there is no way. There is only one way, I think, if you weigh the child before feeding and after feeding. But that becomes very rigorous, and we don't want to do that. That will just make them freak out every single time if we do that. So more practical is to see weight gain over a period of time, say at least 5 days or week, and then having an objective assessment of how much mother is producing. That has got two major advantages. One, if she's producing enough and is enough to meet the child's requirement as per the day, like for a 2-day, 3-day-old baby, even 30-40 ml each time is enough. But for a 7-day-old baby, you need 30 to 40 ml each time. So the demand and the need for the breast milk output also increases with increasing age. If the mother is enough for the age, then she needs to know that she's enough. And she needs to feel confident and take pride in the fact that she's enough and she does not need any support. On the other hand, we see a lot of the other scenarios as well, where the mother actually was thinking that she's enough. But when we see the weight gain and say by the time 10, 12 days or maximum 14 days, 2 weeks is an important ballpark for us. At 2 weeks, if the child's birth weight has not crossed after initial dipping and then regaining, if it has not increased beyond the birth weight, we doubt mother's milk supply. Then also we need the help of breast pump to understand. And sometimes, maybe 70% times they are underconfident and breast pump makes them increase their confidence. But 30% of times, mother is actually not producing enough, especially if the weight gain has not been enough. And we need to still show them that this is what you're generating. And there are occasions when a 14-day child who needs about 60 to 70 ml of milk each time and has not gained weight, rather has lost weight. And we asked mother to, and we were glad that we had our breastfeeding room with a breast pump. So, कंगन को आरसी किया, पढ़े लिखे को फारसी किया. So हमने सिर्फ कहा कि आप जाके breast pump express करके मुझे 15 मिनट में दिखाओ, and they come with a bottle saying just 10 ml. So there is definitely a deficit over there between the supply and demand. And that also is important. What I'm saying is, whatever you are generating, there are multiple reasons behind that. There are multiple ways to at least try to increase the production. But then you need to know the fact. Having not known fact and doing what you are taught by elders is like remaining in fool's paradise. And I don't like that. I like to know the fact and do accordingly. So breast pump is I can't survive my practice or my NICU practice without a breast pump. I need that very, very badly.
Okay, thank you so much, sir. That was very insightful. Sir, I have another question specifically for you. I understand that because how they say it takes a village to raise a child, right? And how do you, as in your professional opinion, how do you collaborate with other healthcare professionals, such as, I'm sure you collaborate with lactation consultants such as ma'am,
Yeah.
and then nurses, and what is just to ensure the comprehensive support for both mothers and infants? How does that whole process work, sir?
So see, obviously, there are man involved and the machine involved here. The machine is obviously the breast pump, which comes expensive. Yeah, so that is one of the limitation I have. And personally speaking, I always prefer electric pump over manual pump. All right, because it's too much for a mother to keep expressing using a hand and then express. She's already stressed out. All we need is to make her, soothe and feel relaxed. So
Right.
I'm so glad that Ankita said the same things. And I always tell my mothers, especially if they have twins, I ask them to buy a double uh, breast pump electric and to attach to this thing. And I expect the partner, the husband, to get involved, and just to put on a platform like this, and a mother hears with a stereo or a Bluetooth headphone. She's hearing songs and or meditative music to feel light. There are fluids kept, either plain water or something, other sips of soup or juice, which she takes. And this gives the entire experience of doing something for the baby, which is very important for the mother. It's all about hormones. So more she expresses, more she feels that she's doing for the baby, better is the milk output because of the hormonal changes. So it's all about hormones. So you need to feel good. It's all feel good factor that is important. So in terms of machine, that is one challenge that I face, that, it's pretty expensive to buy an electric. And I often told some of my parents that a time will come when people will gift, close relatives will gift electric breast pump rather than, some other gifts like clothes or toys. So that's very important. That's a paradigm shift that we need to see in our society to come.
I agree.
Second, I also shared that the pump, the basic part is just a pump, a motor, right? And then the tubings can be changed. But the pump can be, so between two sisters, say, the elder sister can always give the younger one the pump and change this, the disposable part and use it. Now I heard that you guys are coming up with something on rent, which is again going to be very, very financially comfortable for the families, because everybody cannot afford an electric breast pump, which may cost something around 7,000 to 14,000. Now there are cheaper versions in the market as well, but the good ones are actually costing near to 10,000. So that's one challenge, financial challenge with the equipment part. The manpower part, obviously lactation consultants come with a lot of help, and I must thank such lovely women who have experienced womanhood, motherhood, and then decided to follow this path, which is very, very helpful because they can devote the time that sometimes we can't in a busy clinic practice. So hats off to them. uh, Apart from them, I think for NICU babies who are there, my nurses are very important. And the in-charge nurse and the bedside nurse, which has been allocated. We do a one-to-one nursing. So, which means a sick babies, newborn, premature babies have one nurse, one patient. And often the nurse does not change. So there are 2-3 shifts and we keep the same nurse so that they develop an emotional bondage with the family. And we practice family-centered care wherever I practiced, whether it's Medica or Cloud9. We practice family-centered care, which means the family gets involved at a time after the initial crisis is over, and then mother helps almost like a nurse. So her involvement is also important. She again feels good that she is a part of the care. And often in Western world, we have taken rounds during our clinical rounds. We got the particular family standing on the bed and we discuss everything in front of them openly and in a very transparent manner. So all these things are important. And um, I think that's about it for now.
Okay. So just before we go on with our questions, there are quite a few who have joined the live session, and I would request that anybody who has any queries, please post your questions on our live chat. We will address these questions. Our experts will discuss them once our discussions are over. So, in the due course of the time, if you have any questions, feel free to post them on our live chat, and we will address them after the discussion is done. Okay, coming back to the discussion, Ankita ma'am, uh,
Yes.
in your experience, how essential do you find breast pumps for breastfeeding mothers? And um, if you can just tell me some of your experiences. I tell you this because one of the references that you had given me was a very interesting one, where the mother was adopting a child, I believe, and she needed to express. So if you can just give us a few of such examples that you have faced in your practice.
Absolutely. The first example that I'd like to cite is related to what Dr. Mittal was discussing with me, with all of us, was, the importance of family counseling. I really appreciate the fact that, so many doctors like Dr. Mittal recognize this, because as a lactation consultant, when I started my practice, I used to counsel mothers one-on-one. But very quickly, I realized how important it is to have the mother in law also in the same room sometimes. The husband, of course, but even the mother in law, because the mother in law plays a very pivotal role in the upbringing of her grandchild. And mothers feel very, they of course they have a sense of support, they have an advisor, they have this strong network of women who are helping. But sometimes this also acts as a pressure. The mother feels that, okay, am I good enough? If I'm pumping milk and I'm not directly feeding, is it okay to do that? I've had mothers-in-law saying that, मेरी बहू तो, pump कर रही है, क्या ये सही है? Milk का quality तो खराब नहीं हो जाता है? So these kind of questions need to be addressed by people who are qualified to answer them. And people like us need to step forward, and we need to, stand up for these women and help them through this journey. Because apart from this being you know, a huge physiological change, like we discussed earlier, this is also immensely emotional and psychologically draining for the mother. Then again, when it comes to this breast pumps, like the, what yeah, Somrita, you had mentioned, I am constantly, every other week, I'm dealing with mothers who are either adopting a baby, or they are, they're giving birth through the method of surrogacy. Nowadays, medical science is so advanced, and women have that option because, infertility, etc., are on the rise, and for whatever reason, they are not being able to conceive. So, in such cases, by the grace of God, I've had a great medical support system where the pediatricians and the gynecologists have been able to advise the mothers, put them on appropriate hormone therapy medicines, and with the support of a breast pump, because like we discussed, breast pump is what demand and supply. You need to um, trick your body into feeling that there is a demand. So even if the baby is not physically latching onto the mother, we can use the breast pump as a device to fool our human body to feel that, okay, fine, there's a latching movement happening, there's a suckling happening, and our body automatically starts producing milk. So when we are counseling mothers, we tell them to think about the baby, we encourage them, we teach them manifesting techniques, because automatically it's a complete hormonal play, as Dr. Mittal had mentioned, that you need to somehow get the happy hormones or the hormones which make you feel connected to rise. So that is what will induce your milk supply. So in most cases, we have managed to successfully even induce milk supply in women who have not physically given birth.
That's amazing. It's like it's miraculous what you everybody's doing here. Seriously.
Human
Um,
body is miraculous.
yeah, it seriously is. I mean, every time I hear it, I get so inspired, and seriously. Arushi ma'am, I have a few questions for you. Instead of question, let me say it this way. So while we were having this discussion pre this meeting, Mitchell sir said something very valid. He said that the urban women are who you are, who are basically the ones who are using breast pumps, who have these questions, who have these confusions, who have a very busy life nowadays. So let's take a case of a working mother, an urban working mother who is in a very high position, say for example in her company, and so she has given birth to her baby, and she wants to return to work after a 12-week maternity leave. Now she's committed to continuing breastfeeding, and is concerned about maintaining a sufficient milk supply and ensuring a smooth transition when she returns to her demanding job. uh, how do you address this, and how do you support this woman to kind of in her breastfeeding journey?
Right. So these are actually now, thanks to us, all of us working, we have a big set of people, who have these common questions. And actually, this is where it starts from, because most of the mothers, when they're coming just post delivery, the first question is, will we be able to continue? Because we are looking at, joining work 12 week postpartum or 6 months postpartum. So then that is where, when we talk about a strategy that it's worth it, then they find it that yeah, it's worth their time and effort to even start breastfeeding now. Because if they're
Right.
like, if you have to give up in another few weeks, why should we even get into it? Right. So this is where we talk about that, yes, you directly feed till whenever you can, because as we all were talking, that breastfeeding is just not about milk. There's much more to it. There's an emotional bond. And we are talking about the whole process being more psychological than, the physiological part of it. So we tell them to breastfeed till they can, and whenever they start with their work, we talk about using the pump wisely so that they can keep their supply boosted. Now, what happens in the process is that when the mother starts work, there's a lot of mother's guilt, any which way they carry, because leaving your child is not easy, after, and especially just 12 weeks postpartum. So when they know that they can still contribute to their growth by pumping, by giving the breast milk, it sort of helps them, cope up with the whole situation. And as we were talking about the happy hormone, which is oxytocin, so every time they are pumping, there's a spike of that oxytocin in their body. So that helps. That's like a coping mechanism for them also, to sort of help them balance the mother life and the work life. So yes, it plays a very crucial role. Here we talk about a little schedule as to how and when they can pump in their working space. And as sir was rightly speaking, that it has to be more of a meditative process, because if you're sitting to pump in a flustered way, you won't get the desired output. So, losing those positive cues in sense of spelling your baby's blanket or looking at your baby's videos or even thinking about them. So all of this will help you release milk more easily, which is in any workspace it is, right? So over a period, there is more acceptance. The process has started to get normalized. It's not a taboo anymore. It is given that if a mother is going to rejoin, she will need provision to pump or to go back home to feed. Because I remember when I started out work, these questions were asked by my team, my colleagues, that because my child was very small, that would you need breaks to go back home to breastfeed, do you need some provision? So it felt great as a woman that the society is also supporting you. Because I feel that a woman needs to feel happy. An empty cup cannot fill anybody's, cannot quench anybody's thirst. So if work is important for her, she must resume to work. It is not something that she has to do it all alone and she has to give up all her passions and commitments. So if it is important for her, she must do it, and there is a way where she can balance both. And here, using pumps wisely and creating a schedule and a routine really helps her, both so that she can contribute to her own self and her motherhood.
Right. Sir, I keep hearing, and this is a recurring discussion among all three of you, about the family being as involved in the breastfeeding journey as the mother.
Yeah.
Now, I want to understand more about it, because I think most of the mothers think, okay, it's my job to do it. I mean, I have to feed my baby. It's so much of responsibility on the mother to bring up a child from the infancy. Now, when you talk about the family being involved, and how do they support the mother, and how can we talk about that more?
So, Somrita, there are, because I've worked in Calcutta and Gurugram both, I can share with you the stark difference of patient profile. You have to understand the patient's profile also. See, in Calcutta practice, so either somebody is on government job, a few on private jobs, which are much more demanding than a government job, and some are very lucky that they are homemakers. And that is exactly where Ankita was citing that the mother-in-law has got more say, and she needs to be in she always feels to be in command, and she needs to be taken on our side. Otherwise, however hard we try to crack it, it's very difficult not to crack. So the mother-in-law has to be on our side in such situations where mother is a homemaker, and she may have and she will have a lot of concerns about breast pumping, because this is not something that she has used for her own children. This is not something that she has ever heard any of her friends or colleagues speaking about. And obviously, being from that generation, they are technologically challenged, and they don't want to believe in technology. So you have to make them understand and probably give that time to ask, let them ask questions and answer that. What are some of the concerns that they have? They sometimes feel that, the mother will not feel the sense of nursing herself. For sure, that's absolutely right. But these are situations where she's not sure about output, and there may be situations where latching is not optimal, or there are situations where she has to join a job. And breast pump gives them the sense of flexibility. You can pump it out, you can store breast milk. Technically, in refrigerator, 2 to 8 degrees centigrade, you can store up to 4 days. But I often say, use it within 24 hours on a first out, first in model. So the milk that has been pumped out first goes in the baby first. So have a sticky on the plate, on the cup, and write the date and time of your expression and keep it till 1 hour or up to 4 hours, because I live in a city like Calcutta, which is more warmer. So here 1 hour, but in a colder city like Delhi now, NCR, I can allow up to 4 hours also. So they can kept it can be kept in room temperature and then fed. Now, some of the concern that they have is what will happen to the breast. Will it change the quality of milk? Very little change. Very little, because the breast milk is breast milk. And often the quality doesn't change, although there are worries about the change in constitution of the milk. But in my knowledge, I have not seen the weight or later neurodevelopment and mental development, etc., getting affected by express breast milk. I have not seen. The second is the quantity. So if they are worried about the quantity, I often tell them that a breast pump is a machine. So it works like a machine. So it would actually, if anything, it will increase the milk production rather than decrease. So the problem that you can face is over engorgement of the breast, and you may need to have breast milk expressed every 3 to 4 hours. Typically, they form 120 minutes rule. So either 20 minutes, 6 sessions, or 15 minutes, 8 sessions, something like that. It increases blood supply. So that needs to be mitigated. That concern also needs to be mitigated. And this is the only best option anyways. So you don't have an option. Like there are situations in COVID when we had to be in lockdown because there was no choice. So they need to be told that if your mother is going away, or baby is in ICU, unable to suck or directly latch, this is your only best option. And then tell them, okay, so if you do not want to use breast pump, what is the next option? The next option is to give formula milk, which is far more deleterious than an express breast milk. So once you tell them with the confidence and honesty, and I think she will definitely agree. I've not failed any single time in convincing my mother-in-law, my patient's mother-in-law. I could never convince my mother-in-law, by the way. So my parents' mother-in-law, I could convince almost 99%. So that is something you need to spend time. Doctors often do not have time. Although I'm a bit different, I like to talk and I like to convince and I like to present facts and figures in front of them. So that's how it has to be addressed. And your question actually was on, please repeat your question again.
So what I wanted to ask was how the fact that everybody's talking about the entire family, the mother-in-law, and everybody being a part of the breastfeeding journey, and how do you encourage that, and how do you?
Thank you. So taking the partner, the husband, I'm used to the word partner because in Western world, we never say husband. We always say partner. So take the partner, take mother-in-law here, which is absent in Western world. And it's a good fortune of Indian moms that they have so much of support. So involve the family, let it be a meditative experience rather than a work. Let us take pride in that. Ayushi mentioned something about seeing your baby's videos and pictures. And I often think that, in older days, the mother-in-laws were the ones who used to say, even before the baby was born, like in third trimester, after 8 months, that they used to put a Bal Krishna ka photo in the room, in the bedroom of the mother. And I always wondered why. Now, every mother hopes that her child will be like a Krishna. right? In India, at least. Or different, or maybe in different religion it may be different. I'm just talking about what we have seen people doing. So they think that, okay, my child will be as beautiful as Lal Krishna, and that feel also has been shown to generate breast milk even before the child was born. Even before the baby was born, mothers could have some milk flowing in the breast. So imagine when you have the child actually, and for every mother, the child is beautiful. Even for my mother, I'm the most beautiful, handsome man, which I totally don't agree. But then every mother thinks that way. So उसके लिए वो देखकर, something that has been primed even before the baby was born, now she sees the photo and experience the happy hormone is out and the breast milk flows. So entire family participation is very important, and it has to be made a meditative experience.
Right. So, and this is to Arushi ma'am and Ankita ma'am both. How sir said, when you in your consultations, do you often see families coming in, or is it the mother and only the parents who come in to consultation? Also, I would like to just understand from both of you, what is the process? So, sir, I know that sir is a doctor, he's a pediatrician, so he has an inflow of patients. How do these patients transform to lactation consultants? I mean, do they directly go to you? Do they go through a doctor? If at all they want to get in touch with you, how do they get in touch with you? What is your practice like? If both of you can just give a little bit of a brief about that for everybody who's watching the live as well.
So I have a practice of involving my lactation consultant in each delivery.
Yes.
So it comes as a part of package. Our lactation consultants are usually on payroll, and because that helps much more than a clinical consultation outside the facility. So our lactation consultants get involved just as the mother is admitted, or even before admission, in the antenatal period, to mentally prepare them. And sometimes they can relate better, because lactation consultants, I have not seen a male lactation consultant in my life so far. So often they are females, and there is a female to female connect. And especially if you have been a mother yourself, that connect is very important. And I think both these ladies have got that advantage on their side.
Ma'am, if you can also elaborate on this, both of you.
Yeah. I mean, it's very rightly said by sir, because if breastfeeding is established in the hospital, they will never face any issues regarding breastfeeding. You know, that's why they say that feed in the golden hour, the first 1 hour, and that will resolve all your breastfeeding related issues. But unfortunately, it doesn't happen in most of the hospitals. You know, that protocol is not followed by most of the doctors. So I think most of the patients approach, at least talking about myself, is when they are facing issues. You know, when they're painful breastfeeding, they are not able to latch their child, they don't understand if the child is getting enough milk, there's a weight loss. But so basically for us, the key is the determination of the mother. So if she is determined that no, I want to breastfeed my child, and she's unable to do it for XYZ reason, you know, they will either find us through Google or whatever, they will ask around, because yes, it's a very new profession and not everybody knows the existence of a lactation consultant, that there are people who are specialized in this. But yes, you know, it is the determination that no, I have to do it. And when the beginning is, you know, it's not established in the hospital, then I feel it's a downward spiral, because introduction of formula which dips their supply, there's a premature introduction of the bottles, and so much, you know, issues like this which crop up. And that's where they need somebody to guide them, because now they are like clueless. And as we say that we are in an era of information overload, right? So there's so much information coming from so many different sources. The mother-in-laws is saying something, the nurses said something. So there's so much seed of disbelief in them, which is already, you know, planted. So they are in utter state of confusion that what is right, what is wrong. Somebody is saying something else. So I think this is where it is important for them to come to somebody, because as Ankita was also saying, that counseling is a very crucial part. Like there's a whole research which has proven that any counseling given to a mother will increase the breastfeeding rates to at least 90%, you know. So which is, and where the doctors, they don't have the time. Like all the pediatricians and gynaes I have worked with, they say that we don't have that much time, that we spend 20 minutes also to a patient trying to understand their problem, you know, giving them, you know. And I mean, we are lucky to have somebody like Dr. Mittal who does that day in, day out basis, but on a regular basis, we don't see that, which is very unfortunate. And that's where, any sort of counseling, anywhere where they are heard, when they can just like vomit or vent it out, what they are feeling, their problem automatically starts to dissolve. And then they get some clarity. I'm sure Ankita would be able to add more light to the same.
No, absolutely. I completely agree with what Arushi has to say. And, by the grace of God, we have doctors like Dr. Mittal who are very supportive and who are very encouraging towards, they take out time and they counsel young parents. They also encourage, they put them onto lactation consultants who have more time in their hands and who are qualified enough to take care of their lactation relate and breastfeeding related needs. Another interesting place where we do get consultations from is through nurses, because at the end of the day, like, I also conduct classes for nurses in hospitals like Neotia, where, because ultimately, see, we give one consultation or two consultations and we go, but in the hospital the nurses are the ones who are actually taking care. They are seeing them day in and day out. They are looking after their tiniest of needs, so they need to be also taken into confidence, and they also need to be counseled on how to deal with the new mother in a more sensitive way. Because, for us, it's all of us, it is a mundane job, right? You go to the hospital, you meet the mother. For us it's routine, but for a mother, she's overwhelmed. She doesn't know what to do. She has a new baby, she has a new life. It's such a huge responsibility. On top of that, the pressures of the family. On top of that, the stress. Am I making enough milk? Am I doing the right thing? So we are there to ease that load from the mother. So it's for Arushi and me, we act as their support system, their pillar of strength, or their confidant and friend. So we like to tell the mothers that, look, we are your friend here. We are on your side. You can share with us. It's all right. This is a safe space. So that is the kind of environment we aim to establish. And of course, if we have doctors like Dr. Mittal and some other gynecologists that I work with, who introduce us to the mothers from before, what happens is we it helps us build that relationship of trust from before the mother gives birth to the baby. I always encourage mothers to come in for prenatal counseling, because what happens is they know from before that, okay, if we have an issue, we can reach out over here. Okay, I have a doubt over here, I can ask my question over here without being judged. A lot of mothers, they, when they come to me, they ask me that, I hope this is confidential. I'm having this issue, so and so issue at home. I have this relationship issue with my mother-in-law, or my mother asked me to do this. I don't want to hurt anyone's sentiment. Can you teach me how to handle this? So we have to handle it very delicately, tell them, give them the right advice. We need to enable them to make their own decision, because ultimately we are not there to make decisions for them. We are there to empower them to make their own decisions, and also guide them and counsel them, so that they're doing the best possible thing for their babies and themselves.
Amazing.
Yeah, I often say that a lactation consultant is not just a lactation consultant. She's a pregnant or a mother psychologist.
That's a nice way of putting it, sir.
Yeah. Recently, a new mom psychologist is the term for them. They can relate to them. They can speak to them anything.
Right. So coming to this point, we are almost at the end of time, and we have a few questions in our chat box also, which I would like to put forth to the panel. Like Sir said in the beginning, Sanrai Med India has come up with a rental format for breast pumps. Yes, it is a huge issue. There are breast pumps which are quite expensive, and ideally mothers don't just give breast pump because they are disposable. There is a chance of infection and everything. So what we have done is we have started a rental platform, a rental plan for mothers, where the mothers would get the disposable. So the cannula, the breast shield is something that they have to take, and the pump or the machine that Sir said, that is to be taken on rent. And the first month rent is obviously free, and from the second month onwards, the mothers start to pay for a very less rent. What is your feedback on, as healthcare professionals, how would you say this plan is for the Indian market? We'll start with Sir, and ma'ams, you can take over once Sir is done about it. Sir, if you can give us...
I think this is exactly what I've been looking for last 2 decades. And this coming up and being comfortable on their pockets. Because understand, nowadays infertility is on rise, and some of the mothers have become pregnant uh, through some procedure, or whether it's IUI or IVF, and that itself is very expensive process. There then comes the delivery part, which is also expensive, because once you have got pregnant with an infertile in a fertility treatment cases, you tend to have high risk babies, often twins. They may require an ICU care, and you don't want to take risk, and you actually deliver in a place which has got level 3 and ICU in place. So all these actually come with a lot of cost. After that, they are drained so much financially that they do not have the energy to spend anymore. So in this scenario, a breast pump is required, and that comes on a rental model is a very big boon. I must say it's an incredible job. And I don't understand why nobody thought of this before, but then you guys thinking about it and providing this. The only thing is that they need to be given brochures, written information about the safety of using a rental model, that this is just the motor of the machine. The tubings and everything that comes in contact with breast and the milk part and the baby part are all separate. So that
Correct.
has to be made sure. And once that is taken care, I don't think, working women, especially those who are learned, educated, will mind. And this would come very, very handy and very easy for them.
Thank you. Ma'am, Arushi ma'am, your feedback.
Yeah, so definitely, I mean, it's a great model because like as we said, sometimes we just need it for an intermittent time, right? And for that moment, it is so crucial for them to at least try. Now, we also spoke about so many inhibitions which mothers have. So when we say that, okay, try it, it is not something that you're doing like an investment in. So they are more open to it, both the mother and the families, right? So the whole rental model, even like, I think for me, that was a biggest, you could say an important factor, because then the convincing becomes much easier. It's not so much of, because you're not investing as much and it is very easy, and thanks to your services which is like all over, like your connection, so it's very easily available also. So we're not giving them too much thinking time also. So when we say please use a pump, it's available, they use it, they try it, they see the benefits themselves. As we spoke, like sir had also mentioned about seeing your milk yourself, which will boost their confidence that yes, I am making milk, it's not that I don't have milk. Because if anything goes wrong with breastfeeding, the first thing we blame is the supply, as we can't see it, right? So
Right.
once they're able to see that they are able to fill a bottle, it boosts their supply, their confidence, and then we can obviously go ahead with it. So definitely, I think it's a brilliant idea, and it was a much needed thing, especially for the hospital grade pump, because for a lot of premature birth, and a lot of times we need specifically in hospital grade pump, which was not available otherwise in the market because it's very, very expensive to buy. So where we need some extra stimulation, where we are talking about relactation or induced lactation, and hospital grade pump can do wonders because of the high suction, the kind of stimulation it provides to the breast. So especially for hospital grade pump, I think it just opens us a lot of opportunities so that the mothers can, look into relactation or induced lactation or increased their milk supply as well. So I definitely feel it is helping us and the mothers both, in this situation.
Amazing. Thank you, ma'am. Ankita ma'am, your feedback, please.
Yes, absolutely. I think it's a wonderful initiative that you all have started by letting these breast pumps be available for renting purpose, because we are meeting people from all walks of life, and something like this should be available. It should not just be restricted to the hospital. Like in the hospital, like Arushi was saying, we have the hospital grade pumps. You have the if hospital grade pumps are available for rent, a lot of other women would be more encouraged to resort to pumping as well. Also, I think it's so much more environmentally friendly. Why
Right.
waste? Why
Right.
unnecessarily? Even if you can afford it, why waste? It's not required.
I
And
agree.
I think so. If you have like limited breast pumps also, which can be shared or which can be rented, so many women are being helped by just one device. It really, really works. Like when I gave birth to my son, we didn't have that luxury of renting a pump. I would have done it if it was up to me. I purchased mine, and later on, it was just lying. I ultimately I had to have it serviced, and I donated it to so that it would be used in the future by other people. And we don't need this prejudice, like for educated women, for people who are where lactation consultants and doctors, pediatricians and gynecologists, etc., are available to impart information. Women know that, okay, fine, this is safe to use. We can service the breast pump. We can have the device serviced. We can have it sterilized. There is no contamination over there if you change the parts.
Right,
So
right.
only the essential parts need to be changed. The rest of it, it's just a waste to keep getting more and more done.
Thanks. And this is so reassuring hearing it from all three of you, who are basically, you are epitomizing the idea of healthcare professionalism in terms of lactation. I would like to go on to the questions which have been asked in the chat. So Sarika Chola, she wants to know, and this is to your panel, anybody can answer this as per your convenience. How do I know if using a breast pump is right for me?
So basically, it depends on what is the need. So there's nothing like right or wrong. We always have to understand the purpose behind using the pump, right? If you're using the pump because you need to step out and you need to give breast milk to your child, are you using the pump because you want to increase the stimulation? The whole idea behind it is that pump is not going to harm if done rightly. The biggest taboo is that if you, and a lot of I hear this from my mother that using the pump might damage my breast. I might form lumps, I might have fibroids. They use these kind of terminology. So the first thing one needs to understand that it's absolutely safe to use the pump if done rightly. And one needs to understand as to what is their purpose, right? So why do they need to use a pump? Now, breastfeeding is said to be an innate behavior. It is something, it's a natural process. So if it is working well for you, and if it is something that you don't want to do, we say pumps is an absolute choice, So why we
Right.
need to understand as to what is the reason behind using the pump. There's nothing like right or wrong in there.
Okay. Anybody else wants to add anything to this question, or should I go to the next one?
I think you could go to the next one. I think Arushi has covered it up quite well.
Cool. So Cure with Monica, she has asked, if a mother using breast pump, what are some common inconvenience or drawbacks that mothers might encounter when incorporating a breast pump into their breastfeeding routine?
Well, I think the fact is that obviously, like we keep talking about, if you're talking about disadvantages, if you are directly breastfeeding your baby, that is the best case scenario. Dr. Mittal had rightly, he had shed light on the fact that our human bodies are very miraculous, and the composition and consistency of the milk keeps changing as per the need of the child. As the child keeps growing, the composition keeps changing. This when the baby is being directly breastfed by the mother, because of that interaction, I think that the human body senses because of that constant suckling and that physical contact with the child, the human body is so miraculous of the mother that she senses, and automatically the milk kind of it changes its formulation. So I think that would be a lot more accurate if the mother is directly breastfeeding. However, even when she's pumping, it's not like the quality of the milk deteriorates. But of course, direct feeding is always more is a lot more comfortable as well, because you're using lesser devices, right? So if you're breast pumping, then yeah, it is a little cumbersome. You take out the flange of the pump, you have to sterilize that, you have the bottles where you collect the milk, you have to sterilize that. So there's a little bit of work involved. Whereas when you're breastfeeding the child directly, then you just pick up the baby and you latch the baby on. When the baby is done, the baby unlatches and detaches, and then you put the baby down. So that way, and I think it's to each his own. You have your people have their own perspective. Some women who are struggling with direct breastfeeding, for them a breast pump is a boon. So they for them it's it's a device which is practically they're completely dependent on it. But for some women who are very comfortable with the whole act of breastfeeding, they don't need it, as much as women who are struggling. So it's too. I don't think there's any disadvantage as such. I think mothers need to understand on how to maneuver the usage as per their own advantage. So if, for example, if a mother is stepping out, then okay, let me time my pumping session so that I can store some milk and step out. If I'm stepping out for a long time, let me carry the breast pump with me so that I don't get engorged, and so that my milk supply doesn't get hampered, and I can pump milk at the appropriate time. If for a working mother, if she's stepping out, then for her it is, of course, direct feeding is the best, but then when she's at work, she can easily pump the milk, she can store it. So it's on how any and everything is a curse or a boon. It's how you manipulate it.
Right.
And I also hope that our parents understand that what is the indication that Arushi said. It depends on the indication. Why are we using the breast pump in the first place? That's very important. Let no one assume that if there is a latching issue, breast pump is the only option. There's no way that we are going to try to put this idea in their head. There are lactation consultants who will examine the apparatus. I call it apparatus, the breast and the nipple apparatus. They will check it. Often, most of the cases, like 80% of the cases where bad latching happens, it is because of something in this breast and nipple apparatus which are easily curable or treatable. And there are ways to do it, which we all know, like use of certain suction devices or nipple shield, etc. So once all these things fail, then the point of breast milk expression or pumping comes in. That's number one. Number two, to increase the confidence or to show the reality to the mother, breast milk pumping is essential. Number three, a premature baby who will require breast milk pumping for prolonged period of time. Or number four, although we try to extend maternity leave, I write myself a strong letter to their employer saying that she needs 6 months plus 1 more month for complementary feeding, adjustment. So 7 months, I want mom to be there. And in my experience, mostly 90% of times, our letters actually work. And no employer can today take a risk of saying no to such, demands. Uh, and obviously, it gives the flexibility if she has to join job after 6 months, because 6 months does not mean that the breastfeeding has stopped. So even after 6 months, till 2 years, we want breast milk to be given. And mother can, and sometimes there are children who would want breast milk more than the solids, So in such situations, if there is a pumped out milk, might as well give. Last but not the least, there is a situation which I often get a WhatsApp text from my moms that, 6 months have gone, sir. We've not partied. We are partying. Guests are coming at home and this and that. So might be our food may be erratic and we might have something which we normally don't have during breastfeeding. So we allow them with a thought that they can express first and then eat and have lots of water and then may not be breastfeed for next 12 hours or something like that. So because they are also human beings, just because you have delivered a child, a woman does not stop to become a social person. She continues to be social. Rather, she has undergone a lot of restrictive times and she needs to be liberated. She needs to be let to enjoy and have all that she was having before she was pregnant. So all these things are important. I mean, medical science around women and child is such complex and such easy also. It's complicated and easy at the same time. If you feel their pain and their restrictions and you want to feel them liberated using medical knowledge, you can. I don't like to be very strict in my approach. I'm a very lenient doctor. I'm only strict when it comes to breastfeeding. So resorting to formula feed is only valid when my production is low. That I make it very clear. And you have to objectify it. You have to show me the proof that you're not generating enough. Only then I will allow you to use formula milk. So there are a lot of things that we can discuss. And, these ladies also have their experiences and they help families. And I think this combination works. But it's a teamwork, actually. What we can't give sometimes time, they can. They have more focused knowledge. So I think this combination works very well along with the breast pump. So we form a triangle, a love triangle, doctors, lactation consultants, and the pumps.
That's nice. So Sarika Chawla, ma'am, Arushi ma'am, you had answered her question. She has written, how do I determine the right size for breast pump?
So that's I'm glad she asked that question because the flange plays a very important role, the size of the flange, right? So generally we talk about measuring the nipple and accordingly tell the flange, but the new research has said that it's all about the experience. Because as we were talking in our talks, it's all about stimulating the hormones in the body. So the mother needs to experiment with the flange a little to understand that the first indicator is that there should not be any pain and soreness. So if you have pain or soreness while pumping, definitely your flange size is small. Second is the output, right? So a lot of mothers say that our breast feels heavy as a stone, but when I pump, nothing is coming out. So again, we feel that then the flange is not right because it's not able to create the right suction, and hence they're not able to remove the desired output. So these are the two important things to first check when you're choosing a pump, because we have the advantage with Sanrai because we give the option of using different flange sizes, which not many brands do that. Every breast is different and it requires a different flange size. And the most important part is to understand that it's all about the suction difference, the pressure difference where the milk transfer is happening. So if the flange size is not right, we will not be able to create the right suction and we won't get the desired output. So the first, to answer the question in a nutshell, it's the experience. There should be no pain or soreness. Second is the output. You should feel the difference. The heaviness should reduce. Before and after pumping, you should feel the difference in the breast. Hence, you would know that yes, you were able to, remove some milk from the breast. And then if this is not happening, then one must experiment with one size small or one size big to understand which flange is working better for them.
Okay. There's a very interesting question which has come. Does more pumping equals more milk?
I mean, it's a demand and supply game, right? So it's not about more pumping. See, the idea here is to make enough milk for your baby. We are not looking at, and your body knows, like as we said, that, breastfeeding or pumping or breast milk, it's a language which the mother and the baby's body speaks. So the body knows how much milk the baby needs. So your idea is to be able to make enough milk for your child. If you're not able to breastfeed, then the second best option is to use a pump because we're artificially trying to remove milk. If your idea is to create a stash, because you have to work, yes, you can add a few pumping sessions and start creating a stash that can be used later on. So we are coming back to as to why do you need to use the pump, right? What is the purpose behind it? It is not a compulsion. If you are able to breastfeed and it's going fine, great. But it is a choice which a mother is making, understanding as to why she needs to use it.
I think the question is about the volume. So if I got the question, so let me give you an artificial situation, an experiment. Suppose an imaginary situation where the same mother has given rise to twins, and we allocate one breast to each twin. So, Karan gets left breast and Arjun gets the right breast. Mere Karan Arjun aayenge. Okay? So now suppose Karan gets direct breastfeeding and Arjun gets every time express breast milk by pump. Let me tell you, the second one, which is on expression, will get more volumes because it's a machine. So, because what happens with the baby, please understand, the baby is a human or a baby. It's like life. It's a man. If we consider man includes women, of course, but the man versus a machine will do rigorously, whereas a man will get tired. You forgot the complete fact that the baby, once his satiety is getting, there, after some time, 4-5 sucks, then again he will doze off. And again you tickle the baby's feet and then again he starts. So ultimately it's almost like riding a car in a city versus a highway. So ultimate yield is more in breast milk in terms of volume. So अगर आप करण को लेफ्ट देंगे अर्जुन को राइट देंगे और राइट को आप पंप करेंगे, तो आपके अर्जुन को ज्यादा दूध मिलेगा। ये मैं आपको लिख के देता हूँ।
Okay, got it.
Also, another thing I'd like to add is that when we are dealing with mothers who are complaining of of supply issues, we do use breast pumps as a device to increase the milk supply by systematically putting them into a pumping schedule. So like we have already discussed, Arushi as well as Dr. Mittal, that the more you feed the baby, the more your milk supply goes up. It's a demand and supply game. So if we show that our bodies that the demand is more, if continuously every 2 hours the mother is pumping for a period of time, systematically in a consistent way for a few days, the milk supply is definitely going to go up in a matter of days.
Yeah, and then once the stage comes when she's flowing enough milk, we can increase the duration, the interval gap, and make it 3 to 4 hours. Even every 4 hours, feeding in a term baby 4 kilo, 5 kilo is good enough. She needs to pump 6 to 8 times, 7 times on an average. And that's enough for her to generate enough milk and have the goodwill and the sense of pride in her that she is keeping the child only on her milk.
Okay. So Sarika Chawla has raised another question in the live chat. She has said, do I need to use nipple cream after use?
Unless she has cracked nipples or sore nipples, I don't see any point in using. Not as a, it's almost like using diaper cream for a baby who does not have a diaper rash. I often say the diaper rash is not because diaper causes rash. It's in the area which has got diaper worn on it, right? Similarly, you don't have to apply diaper rash cream to avoid a diaper rash. Similarly, you don't have to apply a cream apprehending that it may cause any problem. I have not seen problem. And I think before and after session, if you can just take a mildly warm towel soaked in warm water and just clean it and make it bit moist, that is the only thing helps. Many a times after the session is over, if she's feeling little pain in the nipples, I advise them to apply just the real asli ghee at home, and that is a much better nipple cream than any other nip care or anything like that.
Yeah, means the purpose of the nipple cream is to keep the skin hydrated. It is not helping with any other purpose, right? It's like how we put Vaseline on our chapped lips. So the whole idea is it's lanolin basically. So you're just keeping the skin hydrated. Sometimes the best is that when you are pumping, there's a lot of milk which is residued on your nipple. So we just tell you to rub that only because your milk has a lot of healing properties. Like it's a living liquid. So it is going to help you heal if there are any kind of scars or anything, like or cracks, so your own milk will help you better. So it's not a compulsion, but because there's so much rigorous sucking happening with the pump, as Sir said, it's a machine, skin tends to get cracked. So that's where we just tell nip care, or any of these creams to keep the skin hydrated. The main purpose is to keep the skin hydrated and nothing else.
Okay. So I think we have run out of time. It was a 1 hour session of amazing information. We have quite a few questions. I would request all the audience to address it in the chat box, and we will get back to you from our experts with their views on the chat itself. Thank you so much, sir, ma'am, Ankita ma'am, Arushi ma'am, Mittal sirs, for joining this, for giving us this opportunity to interact with you. Sanrai Med India will always be very, very happy to have you on board and have your expertise for our patients, for our consumers, and everybody who needs them. Thank you so much.
Thank you. Thank you very much.
Thank you so much for having us. It was a pleasure.